What is a yeast infection and how to treat it? If you think you have a yeast infection and want to know how to effectively treat it, keep watching this video. I'm going to talk about the symptoms of a yeast infection and how to get rid of it. Yeast infections are one of the most common causes of vaginal itching and discharge. If you've had a yeast infection, you know what I'm talking about. It's itchy and burning with a discharge. It is so horrible that you will want to get rid of it fast. A yeast infection is a very common and annoying problem for many women. Doctors generally diagnose if you have a yeast infection in order to make sure that it is indeed a yeast infection. However, many women choose to diagnose and treat their symptoms on their own. This can be okay, especially if you've been diagnosed with yeast infections before and you know what they feel like and what they look like. If it is indeed a yeast infection, the doctor, depending on the severity of it, would prescribe oral or vaginal medication. These medications sometimes only provide a temporary cure, and recurrence of the yeast infection happens. Because of how the yeast infection occurs in the first place, it is wise to treat the source of the infection. At this point, I would like to now introduce you to Linda Allen, author, researcher, nutritionist, and holistic consultant who guarantees to permanently cure the root of Candida and dramatically improve the overall quality of your life naturally, without the use of prescription drugs and without side effects. To grab a copy of her well-read ebook, click on the link below and in the description, www.alexornd.com, where you can also subscribe to my free email mini-course on Candida cure. Here are some important things to know. First of all, yeast infections are commonly caused by an organism called Candida albicans when it overgrows in your intestinal tract and disrupts the equilibrium of the microorganisms in your gut microbiome. This is caused by a compromised immune system due to poor diet, particular diseases, and other reasons. Candida albicans normally live peacefully in the vaginal canal as part of the normal flora. It is only when the environment in the vaginal canal becomes compromised by the reasons mentioned above that it becomes a problem. Yeast infections only need to be treated if there are symptoms which include burning and itching within the vagina or the vulva, which is also called the vaginal lips, pain during sexual intercourse, pain when you urinate, and a creamy vaginal discharge looking like cottage cheese. Vaginal discharge in itself doesn't always mean there's a problem. Most women have vaginal discharge every day. Now here's the tricky part. There's nothing in the rule book that says you can't have two infections at the same time. In fact, many women who have a yeast infection have a second type of infection as well, but because they have had it before and believe that they recognize the symptoms, they rush to buy over-the-counter drugs and may be surprised that they are not cured of the infection. This is why if you think that you are infected, you should always seek medical advice to make sure something else isn't going on, like a secondary infection down there. I know that there are tons of home remedies out there that you can try to treat your yeast infection. But as I mentioned before, if you want to treat your yeast infection with something that has been well studied and shown to be effective in treating yeast infections, check out Linda Allen's well-read bestseller ebook by clicking on www.alexornd.com below and in the description.